Well, this is exactly what happens with the mesh as it's put inside your living tissue. And what they've done then as a side product to that, they go, well, okay, if we put it in the middle and it's pulling in multiple directions, what we'll do is we'll bind it to a more solid structure like a bone, a pelvis, an ilium, and that's a more solid structure. But what they don't understand, or what they've ignored or allowed to just be a part of the process, is that that is also a living structure. It is not a fixed innate structure, and it's also growing, and you're distorting that bone, because bone is soft tissue. It's not hard, dead tissue. It's soft, living, organic tissue, and they're using it as an anchor for the mesh to create structural integrity of the softer tissue around it. And this, of course, creates all manner of pain because it's all growing and it's all interbinding and intertwining. And often surgeons have to go in, the likes of Niall Galloway, go in and remove this mesh. Of course, when you remove a mesh, you have to remove more tissue that is grown into with it to try to repair the consequence of it going there in the first place. So that's why understanding biointegrity at the surgeon level is so important, because that's changing their approach to surgery to make sure that they restore structural integrity to areas that have collapsed under whatever circumstances they have, but particularly in childbirth and herniations, which happens often.